good that was captured.
So I will share my screen and hope that I actually have it to share. So if you give me a moment to find that, I will do so. I guess the other thing I would like to do, and maybe Barry or Kathy, while I'm looking this up, it'd be nice to know which committees we currently have identified in this work group, because some of the work we have to do is going to be better accomplished in the smaller committees as opposed to this large one. Is there, Kathy or Barry, do we have a list of those committees?
Yeah, we do. We do have a list somewhere. I mean, we have a communications subcommittee. We have a child and family well-being subcommittee. We have the funding subcommittee. What else?
There we go. So year-round unsheltered committee and winter and severe weather, youth, families, funding strategies, and communications. Okay. Helpful. And now we all know what people signed up for here. And so am I able to share my screen now, Kathy?
Yes, you may.
Is this showing?
Yes, we can see it.
Okay. So I'm going to scroll down to our short-term goals. And Michael, these are the ones, and I tried to roll them up into general categories. And we'll get to long-term goals in a moment, but short-term goals mean we get to experience accomplishments, and I'm all about that. So
I do have a comment about something that I think was lost. As people who have been on this committee a while know, when our last efforts at a year-round shelter failed, we turned to stopgap measures that had to do with increasing the services for people who are experiencing homelessness: laundry services, medical services, the urban rest stop idea, safe storage. Those, in a sense, became our short-term goals. And now I'm talking about, like, 2 years ago, that the topic was about those short-term goals. And that all fell away with COVID as well. But that's not captured here. And I don't know if that is still part of what this work group thinks is important, those non-shelter services that people who are homeless need.
So part of that, I assume, could be in number 6 here, just the effective strategies. So certainly some of those things were addressed in the sense that base camp, we now have, shower and laundry facilities that we did not have before. That was definitely one of those goals. Storage will be coming with the beds that should be arriving any week now. Probably not huge storage. And you mentioned something else, Michael, I'm sorry.
There was the urban rest stop, which I think was going to be done by Unity Care.
And there is still discussion about that underway. Unity Care, Peace Health, and Opportunity Council are still talking about that along with the health department. And I think there are efforts underway to get some funding for it.
I think one reason why the discussion of, like, the safe storage outside of the base camp, and for that matter, what used to be called laundry, and the portable shower truck that Homes Now put together, and the Lighthouse now has one, is that there appear to be a number of people who are unwilling or unable or uncomfortable going to shelters, yet those people still deserve medical care that we provide to other people, to, cleanliness, storage. I was always unhappy with our need to talk about those services shy of shelter, but it really was more than a year of this committee's discussion. And I don't see much that came out of it, and it needs to be a short-term goal or not.
I guess I'd ask others. It seems to me that the government certainly worked with Lighthouse Mission to achieve some of those accomplishments. Obviously not serving everyone, since some people don't want to use those services. But I guess I don't want to give the impression that nothing was done, because there was quite a bit done to address some of those issues. I'm looking for other input from folks who, and I'm wondering if we can just put some sub bullets under number 6 here, Michael, which is effective strategies for working with people who are camping. So those who aren't interested in perhaps using the shelters currently available.
I suppose.
Sorry.
Go ahead, Bridget.
Little request. I wanted to mention, I think too, that for some folks that are camping, they still come in and use base camp showers and laundry services too, even if they're not staying the night. And so that still is possible. So just to your point about how it is a significant increase of shower and laundry services to the community than what was here even a year ago in March or February. It's a huge jump. We didn't have the ability really to do personal laundry before, and now we have it for the 160 people staying with us, and then others that come in. And I mean, it's not an endless amount of laundry machines and times of day, but it is significant. That doesn't mean it serves everyone or it's a good fit for everyone, but it is a pretty significant jump.
Okay, so good to hear that you don't have to stay at base camp to use those services. Helpful. Barry, did you have something?
Well, I was just going to remind us that we did on the safe storage with the lockers. We did tried to move ahead on that. The county funded that a couple of years ago, and then it didn't happen. And then COVID hit, and we weren't able to reconstruct a plan. So I think we tried to address that one for sure. The city actually poured a pad up by the police station to get ready for the first increment of those lockers. So we definitely tried to move that forward.
Right, and there was a group that the city was working with and the county was working with to try to get that going. And we'll have to see if they're still in. Yes, Tara.
Tara Sundin, City of Bellingham. My team is actively pursuing that project again and has been for a couple of months, but I think it has to do with the resource capacity of the operator. So we're still standing by and trying to kind of reinitiate that project.
Thanks. Helpful update. All right.
And Rudd.
Hi, Red.
I'd just like to add, Tara, I'm interested in being supportive on that. I spent quite a bit of time talking to the people and trying to problem solve on that particular issue. And so I'd be happy to connect on that and try and work through the issues.
Okay.
Thank you, Red.
Good job.
Maybe I'll just jump in. Hi, Marcus here.
Hi, Marcus.
Hi, and this is actually a pretty good segue. Interestingly enough, timing wise, I'm part of the leadership of a new nonprofit in town, guys, and it is SOS Bellingham, Serenity Outreach Services. And I want to tell you all about that more and stuff later. But I'd like to echo what Michael was saying. And as SOS, I want to say that housing first, that sheltering first thing is important to us. That emergency sheltering should be where we're operating. I'd love to see somebody move, that we all decide that we're still in an emergency as long as we're in a pandemic and we should operate that way. I think we have some real answers that we could do. We should not be turning away any CARES dollars. So it's important that we exercise our answers when they're on the table. All that said, I've actually just this morning, just today before this call, reached out to Carmen Gilmore from Safe Storage and SOS and Bake. I think we've got a plan. We can maybe make something happen for all of us and now. And so it's an important need in town, but it's not all of it. I think that, of course, shelter is the most important, and I yield.
Thanks for the update, Marcus. All right. So it looks like we've got conversations underway about safe storage, and sounds like we have the ability, and people are using the ability to use laundry and showers even if they don't stay at base camp. So let's just keep in mind those who still aren't using those. And we can, as we talk about some of these other short-term goals, if there's some creative thought we have about how to offer those to people, let's talk about that. So one of the things that is really important to us, and I'll speak as a county employee right now, is that when we are creating responses to problems and issues that come up, we don't get to fund solutions until we've done our homework and determined, exactly what is the data telling us, what are the issues we're trying to address, and then we have to do the research to figure out what are the best practices to address that. And then that's the information we usually take to our elected officials to recommend programs. So I would love to hear from the folks on the committee for, I'm sorry, was there a specific data committee, or was it just budget? Do we have a debt?
Can I briefly interject in what you were just saying?
Yep.
You were kind of asking for some more answers on, it's not putting the cart before the horse terribly. Our idea with Serenity Outreach Services is to try to get safe storage. Their particular conundrum is that they have nice lockers in the back of their locker truck that they used to do a lot of service with, and so it ties up the truck, and the lockers don't have a place to go. So what I'm suggesting is that maybe we could find a site real quick, emergency or otherwise, where we're looking for storage facilities so that we can actually help people store their stuff while they go dry out, and get services and get some of that done and work with. And I'm thinking that if we work with Carmen's operation, the safe storage, and with SOS, we can make that really happen with stuff we've got in town right here. So that's a goal, to try to facilitate that. So the idea of a facility somewhere close to the downtown core would be really beneficial there. And you were asking for those solutions. I think so. Let's talk about that if you want. But
so you're recommending, rather than the original plan, which was the reason the county or the city established a slab and was working with safe storage, rather than erect storage on that slab, you're talking about instead renting space? Do I get that right?
Perhaps some warehouse space, at least in the short term, until all the other stuff comes to fruition, and we'd be glad to help with that as we see the emergent need. Like I said, trying to help people transition right now. And so they're looking for some of that storage space. And I'm thinking that, yes, they can have the doors open, say, and staffed 3 times a week, and let people have access during those hours, and maybe a table with some coffee.
So Marcus, I would love to use that as an example of what I was just talking about, which is I want to make sure that if our committee makes recommendations that we've identified, because we've done our research, how much space we need for that, how much it would cost, how we would make sure people can access it when they need it, and all of that. And I'm thinking that would be important information, because we're more likely to get what we want if we can provide that backup and justification. And so keep that in mind, Marcus, because we're going to bring it up again soon.
Okay, and as a way of collecting the data points, as a point of order on this, I'd like to be able to have it's funny, I just got a text from Carmen, so we'll see how that worked out. But at any rate, guys, we've had a lot of advocates that I trust and know, in whatever capacity I sit here, whether my veracity is called into question or not, whether, at what point does the testimony of all the people that have observed a lot of stuff in town, when do we give that veracity? What sort of data, can we get an outline of what data points need to look like, maybe? Does somebody have to have a degree to take that data? I just wanted some parameters. So
that's what we call qualitative data. And part of that is certainly gathering information from those interviews. And then other is looking, the quantitative data is looking at what is it that we have right now in terms of resources, and how much does that meet the need and where's the gap? But let me, Michael, you've had your, Michael Barris, you had your hand up a couple times and I'm sorry, please.
Yeah, I apologize because I don't know that much about what Michael Shepard was talking about at the last, but I'm just thinking in terms of the Marcus and discussion here, whether what Michael was saying has any relevance as a possible space to be used. And I tuck that away for you folks who know more about this than I do, but maybe there's an answer there.
Okay. So we will keep that on the burner. So I would love to make some forward progress on some data collection and making sure that when this committee meets next, we have some data, not only in terms of numbers, like I was talking about the quantitative information, but also collect a lot of the data we already know from some of the interviews collected, as well as maybe go out and do some very purposeful interviews. We know we have that not only from our homeless outreach team and some of our other outreach teams, but we can get that from other places as well. So I want to find out how many people here might be interested in participating on a subcommittee relative to data collection. Terry, I see your hand, and others who might be willing to help with this. Marcus.
I'm interested. Yeah, thanks.
And Lisa, thank you. Okay, that's a good start. So I think. Yes. Go ahead, Michael.
Kind of a general observation about some of the most important data we may want. It's a general problem of what I would call a masked demand, or what is also sometimes called induced demand. You don't know how many people want to use a sidewalk that's missing until you put it in, and then you see the traffic that safe sidewalk now draws. I think we might have something similar with storage. If we put out 20 storage lockers, we may need to wait a while to figure out whether that's enough or little. I can easily imagine that those lockers wouldn't be utilized for a while until they were discovered and trusted, and then they'd be overutilized, right? We don't know what the hidden demand is, and I don't know what the current experiences is with the shower trucks. I think maybe they're not going around like they used to, but right, there was a bunch of unshowered people, then there were showered trucks. Did we run them long enough to know how many people out there were living without shower facilities, right? And that's really important data. I think we could get similar data if we had a variety of shelters that they would be. I know when we put up winter shelters, they're often underutilized at first, and then they become heavily utilized, again, once they're established, known, and seen as a trusted place to go for sheltering. So I don't think we can actually know the actual demand, because some of it is masked at the moment, and it would be induced or revealed if we started providing services.
So Michael, I'm going to push back just a little bit on that, in that I understand if you build it, they will come, which is part of what you're saying, not completely. But I also know that in order for us, if we are going to use government funds, that we still have to have justification for what we're doing. At least I'm talking as a staff member. As you, I realize you're in a different role and you're much more influential than me, but we can't recommend anything without justification. And that doesn't mean that we don't build upon what we've created as we find the need increases. But I guess I just want to make sure that whatever we recommend is something that we can get through the system.
You make a fair point, Anne. I would just say we may not be able to know the true extent of the need until we actually create an opportunity for people to express behaviorally, yeah, this is what I need. Thank you for this service, or I'm going to use this service.
Thank you, Michael. Marcus?
Yeah, I really want to echo what Michael said just strongly. shower truck guy here, and it was actually my introduction to many of the people that were camped out at City Hall recently. Was in 2018, with the summer of 2018 with the shower truck. Very informative and very data driven stuff. Actually, these names are all there, and their need was clear then, and with advocates who knew what they were doing too. So I've got years of data here and some on paper that talks about the real need of these people. But at the same time, I understand exactly how you're putting it too. But I also, man, it's really important that we understand half of the people that are carrying 2 backpacks around all the time are people that have bone grafts and all kinds of weird disorders that have put them out of the workforce, and that's why they're here. And so they are desperate to be able, or there's people
Marcus,
who want to be
you
able to
are
take
on the committee, so you will have
I just want to make sure
influence.
I want to make sure that we're talking about this and framing this in the realm of real experience, and that is data that I'll produce that if you want.
I think that's what the work of the committee, the subcommittee. Michael Barris?
No.
Oh, you did. Okay. And Riley, was that you or you're just adjusting the camera? Okay. So not to put you on the spot. Okay. Got it. All right. And so, yay. I think data is going to be critical to some of the future work we do, short term as well as long term. I really want to make sure that we are credible in our recommendations, and that we also understand that when the recommendations are made, we need money. There is a budget subcommittee that met a few times, and Michael, it seems to me that were you leading that, Michael Lilliquist, or?
It's a funding subcommittee, not a budget subcommittee. We have met. We've had difficulty meeting, though. That work is ongoing. It won't be a surprise that, I've reported on before. We are trying to not only determine the basic, grossly speaking, how much we spend as a county. It's around $12 to $13 million this year. What is the unmet need? We don't have numbers for that. It'll be in the millions. And then what are the possible funding mechanisms, of which one could bring it up to $6 million, and there are others that would bring in one-time funds. And the point behind the funding committee is not to talk about the solutions, but to more talk about the money that could go towards the solutions. So if there's a solution for families with children, we're not coming up with that, but where we might be able to contribute some rough magnitude dollars that then be applied. So it's not really a budget, right? It's really more, these are possible funding tools that policymakers, county council could consider going to, or asking the voters to go to.
Okay, that's really helpful clarification. Thank you. Emily.
Well, I guess I'd just add on to that this committee could certainly make a recommendation to the councils about implementing some of those potential funding opportunities, like, I don't know, say 1590, for example, that county council could implement that would generate something like $5 million a year for housing and behavioral health supports. 6, thank you, Michael, somewhere between $5 and $6 million a year. It would be super helpful, and that could be something that could happen countywide through county council. And I and others would certainly be in favor of a recommendation from this group to that, or spending some time talking about that if that feels like we know we need more resources or we can't move forward. So those are some of the, like, we're trying to get concrete as opposed to just abstract. We know we need more money, but what are the opportunities? And let's talk about it as a community, and put our action where our values are.
And Emily, as long as you brought that up, I'll just make sure the group knows what you're talking about. There is a state statute, and it's 82-14-530, that allows for a county, or if the county does not choose that option, allows for a city to implement an increase to the local sales tax of 1/10 of 1%. That's 1 penny on every $10 spent. dedicated to affordable housing creation and also allowed to support behavioral health facility operations. At least 60% of that collection must go toward development of affordable housing, and it also identifies special populations in particular. And so, yes, if the county passed that, and the county council can pass it, city council can pass it. If the county does it right now, we're estimating between 4.5 to 5 million based on some of the COVID economy. But if the city passed it, it could be somewhere between 2.2, 2.8 million or so. Again, dedicated not to shelters, that's not allowed, but certainly would address the solution to homelessness, which is housing, of course. So that's just what that law, that statute is. And we call it 1590 because the House bill that passed that legislation was number 1590. Rudd?
I just want to remind people that there's a cost to all of these things. And the calculation, if you took 6 million across the county, I think you said, was it 6 or 5?
Right now it's closer to 5.
Okay, so if you took 5, it turns out to be roughly $70 to $75 per household of additional sales tax. And unfortunately, the way our system is structured, that would disproportionately affect people who are very low income and on the board, on the edge of losing their existing housing as it is. It's not a tax that is only going to apply to those who can afford it.
Thank you, Rudd. And that's certainly something the elected officials have to battle with on a regular basis. So, Michael Shepherd?
Yeah, have there been any recommendations from any of the other committees that work on housing to the county? I know we kind of have another sister committee that works more on affordable housing. Have they made any formal recommendations to the city or county on that 1590?
There are 2 different advisory committees to the county. One is the Housing Advisory Committee and one is the Behavioral Health Advisory Committee. The Behavioral Health Advisory Committee did not recommend it, really for the reasons that Rudd Brown just discussed. The Housing Advisory Committee was more in favor of it, in part because their role is developing affordable housing. So that's what I know about that. Yeah.
Okay, thanks. Washington struggles with regressive taxing. We come up as one of the top, 2 or 3 regressive tax states in the nation each year because of our reliance on sales tax and disproportionate unreliance on income tax and other mechanisms. So I can see the complication. It would be great to have those funds, though. We would do good with them if we had them. It's unfortunately not the easiest way to decide to get those resources.
Thank you. All right. So now that we have a data committee, I think one of our first tasks will be to outline, and I'm asking this committee right now, what are some of the questions you want answered that will help you make recommendations for how to improve shelter services and other support services to people who are experiencing homelessness. So I'm going to write all these down, but what are things you want to know, Emily?
And do you mean what are things we want to know from the data committee?
Yeah, what do you want them to ask? What do you want them to find out?
I love this game.
Yes, it's great.
Data, please, let's equip ourselves with data. Well, here's just a suggestion to kick us off, which is to look at the annual report cards that come out of HMIS and take a look at, and I've got some of it open on my screen here, about how much it costs us to buy permanent housing using an emergency shelter option, a transitional housing option, and a rapid rehousing option, and to actually look at the effectiveness of our system as it relates to all three of those interventions. This is easy to get data, and I think would really help inform us as a committee if we knew, for example, that it costs $238 a day for us to keep somebody in emergency shelter and only $38 a day for us to keep someone in rapid rehousing, which is actual permanent housing. So that's just a Kickstarter. I'd love us to digest that data.
Emily, I'm going to put you on the spot. Do you mind
Okay.
defining rapid rehousing?
Yeah, so rapid rehousing is when we combine case management with a pot of rental subsidy so that we can pay people's rent. And we use private sector housing, so any landlord with an opening. And we put the case management, the rapid rehousing, and the housing unit that we can find, and we help folks get into housing, and then we pay their rent for a period of time that is designed to be not permanent. So it could be anywhere from 6 months to 18 months that we're helping them with their rent. And it's also designed to be sort of tapered in nature. So maybe they lost a job and they need us to pay all of their rent for the first few months or first many months. And then slowly as they get back on their feet and get their income back up, we're paying subsidizing less and less of their rent. So for example, it costs us as a community just under $12,000 for every successful rapid rehousing exit. And it costs us like $54,000 for a transitional housing exit. So it's just like quick comparisons. And we have a 78% success rate of serving people with rapid rehousing and having them exit successfully. So this is the kind of data that I think should inform the types of recommendations that we make as a committee in terms of what's the most efficient way for us to house people and quickly get them into safe, permanent housing.
And so let me push back briefly, and then Michael, I see your hand up. And so this committee is really looking at shelters. So how would you balance that with permanent solutions to homelessness, which is, of course, one of the roles of the Housing Advisory Committee?
Well, one of the ways for us to need to have less people unsheltered is to house them. And so I think to your point, Anne, at the beginning, like we have to pay attention to the balance, because if all we do is invest in emergency shelter, then nobody's actually getting into housing. And so when we don't invest in case management and rental subsidy, we see the unsheltered numbers continue to go up. So we have to remember there's multiple ways to address people who are unhoused. And what we really want, what I know we all want, is we want housing for them. We want actual housing for them. And of course, we don't want them on the street, but there's more than one way for us to get there. And it's a matter of being able to simultaneously keep an eye on both ends of the spectrum so that we don't keep chasing our tail, needing emergency shelter without actually ever moving people into permanent housing. So I think we can't as a group just put blinders on and look at emergency shelter. We have to, as you said, look at the whole continuum, but we also have to be really smart about our resources. And if we're going to spend X number of dollars on emergency shelter, we should also be thinking, how many people could we permanently house with the same money? And what's the smartest way as a community for us to make the biggest impact?
And so maybe one of the other things we need to ask is, how much are we spending on responding to homelessness that is not really a solution to homelessness? Okay, Michael Lilliquist and then Michael Shepard, and then Mayor Fleetwood.
Well, I want to say that what Emily's doing is cleverly subversive of this committee, because the committee is charged with increasing shelter capacity. And when I say cleverly subversive, one way I might understand what Emily is saying is, rather than increase the number of shelter options for people who are homeless, what if we just reduce the number of homeless? And so that shelter capacity came in line that way. Understand the driver of the population. And so this committee could basically turn around to the county council and say, you made a mistake when you told us to increase shelter capacity, because you should have asked us to do what the other committees are doing, which is reduce the number of homeless by augmenting those pathways out of shelter rather than augmenting shelter. And so the data that she was talking about, the amount spent, could help inform a recommendation to say to the county that as much as our charge is to increase shelter capacity, we think it's equally or more important, I don't know what we'll say, to decrease the number of people who need shelter by doubling down on our rapid rehousing efforts. And then I would say one more thing, which is data would be useful, might have to do with the tenure of people in homelessness. Are they chronically homeless by the federal definition of over 6 months? Or are they those people who are on the verge of homelessness or at risk for homeless, or sort of like sheltered but homeless, like on someone's couch, in someone's car? Because that might also go to the kind of solutions. If we find that we have a whole lot of people who are not yet chronically homeless, then we say, wait a minute, this is a failure of rapid rehousing. But if instead we had a preponderance of people who are chronically homeless, we say, wait a minute, this is a different kind of failure. This is a different kind of failure to address what are longstanding disability or challenges in the people who are homeless. And more shelter isn't going to solve that either. So I think tenure and maybe what the particular barriers are, and that may be in the point of time count. I haven't looked at those numbers, but that would sort of describe the character that people were hoping to serve. And it might do what Emily's maybe suggesting also, which is that different people who are in our problem pool of homeless people might have been dealt with better, more effectively upstream, or might be dealt more effectively, cost effectively, as well as effective in human terms with rapid rehousing rather than with shelter.
Thank you, Michael. Michael Shepherd.
Yeah, related to that, one thing I don't understand is the number of people who are currently experiencing homelessness that would fit into a rapid rehousing model versus those who need a model that has active case management support that includes addiction support or other types of services that I don't know if those come with that rapid rehousing model. And I don't understand the differentiation between the population and just how many people in that homeless population could get tracked into a rapid rehousing and how many need that plus other support services so that they're able to be ready for a rapid rehousing.
So Michael, those are great questions, perfect for a data collection committee to look at. And yes, there are other types of housing. Permanent supportive housing, for instance, is one that would be more likely to support people with complex needs. So great questions. So Mayor Fleetwood, and then I see Marcus and I see Terry. And then I see Michael Barris and I see Bridget.
Just responding to the comment by Emily, you pointed out rapid rehousing and getting into permanent housing is the primary object, but also recognize the need for crisis-based emergency response sheltering. And you said we need to be careful to strike the right balance. Do you have insight into where we strike that balance and how and why? Maybe conversation agenda item for another day, but I'd be interested in that.
I think that's a great discussion for this committee is to set a target of what do we actually think we can reasonably sustain and support in the emergency shelter realm. And then if we commit to that, whatever that is, whatever that array of emergency shelter that we say, like, this is a good, we could be proud of this if this was our mix of options as a community, then the commitment has to be on the other side to make sure that if we're running out of space in those things we have decided is the right mix, that we up the investments in rapid rehousing and permanent supportive housing and the other supports such that we don't overflow and overwhelm the emergency shelter system that we have designed and created intentionally. And that means flexibility and responsiveness with our city and county partners and private philanthropy to do that. But that could be one way to approach this issue so that we aren't constantly saying we need more and different kinds. Let's set targets, let's get there, and let's understand that then we need flexibility to make that capacity workable. And that's a statement of us as a community saying we're not willing to go above this. If our unsheltered population is ballooning beyond what we've created, it's time for us to come back and say, how do we fix this? So I think that's a great question for this committee and for the community to weigh in on.
Thank you.
Great. Okay, and then Marcus and then Terry. Marcus, you're on mute.
Oh, I beg your pardon. I just want to echo, strongly echo points made by Emily and by Michael. When we're talking about when we're talking about the cost of sheltering versus triage, outreach in the streets and stuff like that. This is data that can certainly be brought up, and it has been brought up before. And it's a matter of record stuff from back in 2019 early. I know that, you know, the outreach that went on at that time, you know, we spent like with Homes Now and other people, with other people, maybe $30,000 in 6 weeks, just from citizens. So it was so that's something that we need to be aware of. But I really want to also make sure, because we are in this state of emergency, as I previously stated, and housing is certainly, of course, sheltering is of course very important stopgap thing. We've all seen 210 Camp 2 that is still a problem, you know, as they call that down there at Civic Field, and other, you know, scattered, of course, from 210. But I think that I can't stress enough that we're A, in an emergency, B, in a unique position to take emergency dollars and buy these shelters so that we own them, so that next year's budget we can actually be able to reach down the barriers, if you will, and get outreach. And I mean, I'm sorry, get social workers, get that more intensive care for those people. And so where the barrier might fall with that type of sheltering is not who is unshelterable, as a word that we've heard before, but rather who's unvillageable, who would be too disruptive in a village, and then figure out that population. But I mean, if you want to find those numbers, that's something that we can easily do from the stuff that we have going on. But I want to really, I just want real shortly, another thing that I want to really keep in mind, because I hear this coming up, you know, identify who these people are and who these people are. In fact, we need to soften the landing pad for somebody who's freshly homeless, like I just got out of my apartment, everything I own is on my back. What do? I gave money to the mission. I'm going to go down to base camp and try that. And if that doesn't work out well for them, they end up at the very bottom within a week. And that is where we need to do. That's a big one that we all need to tackle as well.
So Marcus, I lost you. So in terms of the question, what is it that you want the data committee to answer? Do you mind just trying that in 25 words or less? What you just said? Sorry, I got lost in it a little.
I think that we need, again, to quantify the folks that are going to need the more intensive care. That villageable is a word I'm kind of coining here. Because it just wouldn't work well in a village or not. And then at the villages, then you can kind of, it's rather a sorting hat, and you can move people right through into so I'm trying to push.
Okay, I think I got it.
I'm trying to push for us all again, the village model, and something we should be taking advantage of with the CARES dollars we have right now. And I can't say it enough, or don't know when to say it, but now is the moment.
I got it. I do want to respond to something you said earlier, Marcus, that we shouldn't be sending CARES dollars back. I can't speak for the city, but the county's sending nothing back to anyone.
No,
so,
I know how it is. Yeah, sometimes it just goes unused. Put it that way. We don't necessarily get everything.
All of ours is totally used, totally. And I see Riley,
Ferndale is the same. City of Ferndale left nothing on the table. Every cent we took.
Perfect.
Yeah, I think that's probably widespread. And Rudd, I think, said the same thing. Okay, so Terry, and then Michael Barris, and then Bridget.
Thanks. We know a little bit of who is in the rapid rehousing appropriateness and who is appropriate for permanent supportive housing. And we track that by engaged households in our system, right? So at any given time, and this doesn't fluctuate a lot, roughly 40% of all households who are looking for services fit into the rapid rehousing model. And roughly 50% fit into the permanent supportive housing model. The importance of the continuum that Emily is talking about is that if we do not adequately serve people who need rapid rehousing, those households de facto become permanent supportive housing households because of the time they're left outside, the acuity that increases, and then they become chronically homeless. So if we don't adequately invest in the appropriate intervention, we're necessarily investing in the most intensive intervention.
That's the old announce of prevention is worth a pound of cure. Is that the, it's hard to argue against that, Jerry. Thank you. Michael Barris.
A couple of comments about the research committee. I'm really glad to hear us talking about qualitative research, because it's very different than traditional quantitative research. It should give us the chance for so many of us who are talking about people who don't want certain kinds of housing, instead of us defining what they think, we let the people define why it is that they don't like certain kinds of housing options or shelter options. I was trained as a qualitative researcher about 1,000 decades ago, and it's very different. So I'm thrilled about that. Secondly,
but Michael, your name isn't on the list for the committee.
I would be glad to talk with the group or work with the group. Secondly, those 83 different cities and counties that are part of the Community Solutions Group, this is also about the research, strongly take a stance against using single annual point in time counts. They say it doesn't provide the information to them because the data changes daily or weekly or hourly or monthly. The last thing I want to say is not about research, but I want to urge everybody to read and reread for a second time the letter that Lisa Marks wrote that's in the packet. It's easy to miss that point. But in the days when I was still working, I was a youthful person, not so bald, but I was a special ed director in Ferndale and then in Bellingham a long time ago. Had somebody come to me with that letter about setting up secondary voc training programs, do it in concert with other community agencies, somebody buy the supplies, I would have made that thing work no matter what anybody said. And I think what Lisa's onto, we need to keep in the back of our minds. You know, it's not that it's the ultimate solution, the long term, but it's a good short-term solution to be able to buy 250 tiny homes that Marcus will forever keep bringing up as an important issue. But we need to consider her economic factors. I would have been thrilled and I would have made it work. So please, if you haven't looked at Lisa's letter, I hope this is clear, go back and look at it. We can do it way cheaper than anything we've been talking about. Sorry.
Kudos to you, Lisa. That was in the packet, and so absolutely give it a read. And Bridget.
Thanks, Anne. I just want to go back to what Emily was saying initially about investing in these other solutions. And I just want to second that. I think that it's really important for us to consider those things because if we as a group continue to focus on shelter options, and as you know, at the mission, we are very much in that crisis intervention place on the continuum of care. And though we provide recovery programs as well, it still is a stepping stone to more permanent housing. We ourselves do not provide the permanent housing. And so what we have even seen internally is if we create a larger front door, a larger lobby, so to speak, we have to have rooms in the back to put people. And so we can't just continue to invite people into a lobby and welcome them into that space and then not have the capacity to sustainably move people out of the lobby. Speaking symbolically about like base camp being this lobby that we invite everyone into. And then if there's no resources for them to gain housing, to move up the continuum of care and move along that, then it will reach that capacity and those people will be there for much longer. And I would reiterate what Terry said as well. And then trauma increases from being on the streets and having 160 roommates and, you know, all of those things that come from that sort of instability. And though we've tried to address as much as possible in shelter, there is that reality of it is never supposed to be a long-term solution for somebody. And so we need those other options as well. So I think part of me says, that we can't address. We can't speak to just furthering shelter options without also thinking through the next thing that we're sending folks to. Just a thought. Thanks.
Thank you, Bridget. And I think it's important for us to remember that at least the official HUD definition of homelessness, people in shelters, people in tiny homes are still considered homeless. And of course, we want to treat everyone with dignity, respect, provide the support and health they need, and we want people to be housed. We don't want people to be homeless. So very important. All right, so this is what I have so far in terms of the questions we're asking our data committee to take a look at. One is just looking at the costs of the various services to include sheltering versus different kinds of housing opportunities, and keeping that in mind as we're balancing recommendations relative to shelter versus perhaps investments in housing. Making sure that we really do some qualitative work, as Michael was helping us understand on both Michaels actually, on who is homeless right now and what are the barriers they're facing to housing, and how long have they been homeless, and what has worked for them in the past and what isn't working for them now. And then also maybe another item was to look at the number of people that we believe right now would be a good fit for our different housing programs, rapid rehousing, permanent supportive housing, and that that might also help us understand what kinds of responses we want. And then, and I hope I got this right, Marcus, but really quantify those who, I guess I would say, have very high barriers, that really have difficulty living in any kind of a congregate setting, even perhaps even in a village that has a number of people, and what are the issues that those people are facing, and what is it that we might have to offer that would help support them.
I'd like to see both ends of the spectrum really identified, because there's people who need first, last, and a deposit, and they're on their way too. So we did getting them sorted out, so there's not the drop all the way to the bottom just because you're taking shelter in Bellingham. That's
great.
That's something to see.
Part of what Terry was talking about. Any other questions we have, Emily?
Yeah, I would add two things, though I think I just forgot one of them. The first is to, which we already have this available, but to disaggregate that data by race so that we can see where we've got overrepresentation here in Whatcom County. That's an important issue. And I guess I would add a subset to that, that when we're looking at households with children, if we can include the race of the children in that, because I know at Lydia Place that really shifts the disproportionate representation of people of color. So that would be good if we can dial in a little bit on that conversation and bring that to this piece. And the second one, which Terry, I'm happy to send you the spreadsheet I created, is if we can also include, when we look at that housing pool report and this data from the housing pool, if we can also just put together some really basic rough estimates about what it might cost to buy all of the rapid rehousing that we need, that 40%, what it might cost to buy all of the permanent supportive housing we need, the 50%, and the remaining 8 to 10% of diversion. And I'll send that spreadsheet to you, Terry, and you can change it as you see fit, but it would be nice to share that out to the group too, so that we can see how much money are we really talking about if we wanted to scale up these interventions to right size it to the housing pool of like today or yesterday.
And the housing pool is those people that have been in touch with the homeless service center and reporting that they're needing their services, right? Okay, that's a great list. So one of the things that this makes me think about is the importance of making sure that we use our time wisely in this committee. One of my recommendations for us to discuss here before we end this topic today is really, is there a way that we can use our committees more than this one large committee. I feel like it's very difficult with a large committee to get some of this work done. This is complicated data. It takes a lot of work to make sure we're asking the right questions and then receiving the right answers. And one of my recommendations is that we make some assignments to some committees, that we wait for this larger committee to meet until we have some of those answers and we bring it back, so that this committee has robust information that can help generate some real problem-solving discussions. If I think about the way some of the other committees of government work, city and county, is that we often have these larger committees meet every other month, and then there is work done in between, so that when the next meeting happens, there's a lot of information that's been collated and presented, and that we really have some forward, we have an opportunity for forward movement and decisions that we can stand behind. So something for us to think about in terms of how we actually get this work done now. So we've identified short-term goals, we've identified information we want. So the next step is, how do we accomplish that? Marcus. And you're on mute again.
I was going to speak more to that, but I'm ready to kind of move along with the subject matter too. I think that there's a lot that we can gather with what we can consider an emergent need, and actually protect people who are on the street right now, and use it as rather the Harry Potter's sorting hat. I hate to use a reference, but it actually makes sense. If we can, when we reach out with our outreach services to people who are just brought in off the street and figure out the demographics that we're looking for, I think we can much more readily and efficiently identify their needs and direct them from an emergency shelter status. I think that some of that has happened in the last emergency shelter that was opened, and I'm thankful for everybody who's involved with that. I know volunteers who wished that they had seen more outreach there, and that's okay. I know I went and did outreach. I was there when it was closed, and so I just want to value that, the ability to hold people still for a minute and get them sorted at that moment, and that is the data that we're, that should be the key. I'm thinking right now is a great moment. We're in an emergency. It's not going to stop for a while, and it is winter, so it's a winter emergency. And if we could just think about it that way and move forward that way, it's the most humane way, and we can get all the data we're urgently looking for. I appreciate everybody's efforts.
All right, so I was given 60 minutes for this conversation, and we are at that limit now. I think long-term goals, we can't ignore those, but I do think we have a sense of how to move forward with short-term goals. And Barry, do you want to take it from here, or do you have other requests of me?
No, I think you've taken us through the first piece of this, at least the short-term and the data piece. I think we need to kind of think about that for maybe our next meeting. I would suggest our next meeting be regularly scheduled in 2 weeks, and we can maybe work on that structure of how committees might be able to lighten the load, and we can make an informed decision about maybe how often the full committee needs to meet to be effective. But I did promise a 20-minute public survey or public comment period, and I want to make sure to honor that. But I see Tara's got her hand up, and I want to hear what she has to say.
Just really briefly, I was wondering if the Winter Shelter Committee could discuss and consider making a recommendation to the county council, say May or June of every annual year, so that the community, the county council staff, or the county staff, city staff, have time in the community to adequately prepare for the winter. So just kind of thinking about recommendations, official recommendations to the county going kind of late spring.
Thanks, Tara. Okay, with that, I think it's 20 to 3. We will open the public comment period, and we will be closing it and adjourning at 3 p.m. so everybody can get on to the rest of their day. So Kathy, could you please call the first person?
The first speaker will be Doug Gustafson, followed by Amy Glasser, and then Catherine Orlowski. Go ahead, Doug. Please state your full name for the record, and you have 3 minutes.
Hey, this is Doug Gustafson from Homes Now Not Later. I wanted to say that Homes Now manages 2 tiny home villages, the first 2 tiny home villages in Bellingham. Swift Haven and Unity Village continue to run smoothly and safely. We have a model that we do not have any paid staff, and it is resident run. That is why we have been able to scale up quickly with Swift Haven and get online in just a few weeks. We have residents from Unity Village that were dedicated to setting up a new site, making sure it's run right. I heard the discussion today in the work group, and I wanted to kind of make a comment on that. Homes Now, I think we were talking about housing versus shelter. Homes Now, I would put into the category as the best bang for buck option in Bellingham, and we are emergency housing, not emergency shelter, emergency housing, because this is what a zero rent situation looks like. We have the facilities people need. We have individual units that people need. They have heat, insulation, electricity. We make sure they get laptops or a phone so they can get back on the internet like everyone else. We're not experts in it. It's not perfect. But the point is that you have to get people out of survival mode. When you're at an emergency shelter, no matter how good the shelter is, you are still in survival mode. And the rules to survive, the rules to thrive in our society, if you're in survival mode, are a completely different set of rules in order to thrive and survive when you're not in survival mode. So Homes Now represents a bang for buck. This is the minimum amount of money needed in order to get people out of survival mode. And then once people are actually out of survival mode, they start to figure out their own problems for themselves. A lot of times it is, as what Marcus described, where they just needed to save up first and last month's rent, and then they're out. Sometimes people are on disability. They're waiting on housing from the Opportunity Council or any other provider, and it hasn't come through yet. So they're the ones, as perfectly capable adults, who run the place. Now, when we're talking about barrier levels, I don't really like to look at it in terms of barrier levels. Homes Now, for example, is ending homelessness one person at a time. So we have had residents that would be classically defined as low barrier before, and then we have had residents that would be classified as high barrier, and it's basically like case by case basis, and you have to look at each person individually, and they have a totally different set of things that will help them get to where they need to go. I could talk for hours, but I know that I only have 3 minutes, and I'm at 2 minutes and 55 seconds. So you guys take it easy. I just want to let you know, take it easy.
The next speaker is Amy Glasser, followed by Catherine Orlowski and Diane Foster. Go ahead, Amy. Please state your full name for the record. You have 3 minutes.
Okay. Notepad. Okay. Can you hear me okay?
Yep.
Okay. I'd like to start with addressing what Ann had said. Ann, I'm sure you don't mean to continue to miss that people don't want to or are unable to go to base camp. That's not an option when you come to increasing your numbers. It's just now 70% full. The storage there is unacceptable for the amount of items people have, and they need to keep their things safe. The beds still aren't there that were promised, and those banned or afraid to go there still have nothing. We're in a pandemic, and any tiny shelters are a great idea for stopping the COVID spread. I think that could be justified for care dollars. We still know pallet homes could be here within a few days. We're in a pandemic. The Mission shower truck should be utilized by the city or this new SOS nonprofit. At least they can, that's the least they can do when they have showers inside and the truck isn't being used. I also wonder why the BHAP program, Behavioral Health Access Program, stopped private outreach therapists when the agencies were supposed to take over the program, local agencies, but never really did. This is a huge gap. There's a need for emergency storage location right now. Maybe more people would go to base camp if people's belongings would be safely stored at another site and immediately accessible to them. Immediate laundry vouchers to wash wet clothes that can be saved instead of spending more money and having more volunteers spend their money, energy, and risk. How about having another nonprofit like SOS manage Holly Street Shelter, as it's underutilized now and people won't go there because it's through the mission, but it is a wonderful extra shelter. Now, along long-term goals, building codes have to change. Tiny homes can be permanent. Many people would be happy with the tiny home forever, and it's good for the environment and for those who will never qualify for local housing. Urban rest stops, also a great idea, but what's taking so long if it's been 2 years? Your next meeting's in 2 weeks. That's not emergency action. Stop saying what you can't do and figure out what you can do immediately. 40 degrees is certainly well over freezing, but when it's raining and windy, it still causes hypothermia. Health department, you know this information, and you can't go by how many dollars you have to spend on shelter. You have to go by how many people will die. These are just my thoughts. I hope it matters, and I agree with everything Doug said. And if you want numbers, get the numbers of how much money the mission is spending for each person that's actually staying there. Because without those new beds, and with it being only 70% full, I think you're overpaying for your service and it could be utilized elsewhere. Not to say those 70% aren't good there, but that's a big gap and a big amount of people who could be served elsewhere by other agencies. Thank you very much.
The next speaker is Catherine Orlowski. Go ahead, please state your full name for the record. You have 3 minutes.
Hi, my name is Catherine Orlowski. I am a member and working with SOS now. And as Director of Advocacy and Volunteers, I'm really hoping to bring some legitimacy to our massive network of community volunteers. It's huge. It's personal money that the community is spending. And we've all noticed that there needs to be some sort of oversight of all of the current homeless programs. And this is per request of the homeless individuals. As you collect your data and you're looking at who qualifies for these programs, please take that very seriously and consider that some of these programs look at collecting the barriers that some of these programs might be creating for these non-qualified individuals, because that's going to lead us to the other solutions that we need. I appreciate all the transparency and hard work done by this committee. And I agree with the introduction that the community at large has often a different perspective and a false narrative that many of the experts and organizations are sending out, that, you know, the community resources are available and that these people are choosing not to take these options because of their addictions and whatnot. That narrative is very damaging and dangerous to these individuals. And the community at large needs honest information from everyone. I wish they'd all listen to your meetings here because you guys do good work and it's very valuable. I also want to request a meeting with Seth with SOS, because we've been working at this really for a long time in the community. And we have some great solutions that we could take on immediately because this is an emergency. I also want to say that what Doug and Amy just said, I completely agree with. And thank you for continuing to have these meetings, and I yield my time.
The next speaker is Diane Foster. And if anyone else would like to speak after Diane, please raise your hand virtually by clicking the hand icon or dialing *9 if you're joining by phone. Go ahead, Diane, please state your full name for the record. You have 3 minutes.
Hi, I'm Diane Foster, and I'm not an expert. I just live in Seahome neighborhood, but I'm really loving the Aloha Motel as it unveils itself down the street from my house. And I was walking down Cornwall one day and there was a man asleep, camping out in front of the old J.C. Penney building, which is owned by Doug Tolchin. And I thought, what a waste. Why couldn't they just unlock the door and let this man sleep indoors instead of outdoors? And the same thing with the Triangle building right down the street from me. It's just sitting there empty. Like, why can't the city just order them, as an emergency, obviously very short-term solution, but why can't they just do that? So that's all I have to add. Thank you.
If there are any other members of the public who would like to speak during the public comment portion, please raise your hand by clicking the hand icon on your screen. Or if you're joining by phone, you can dial *9 on your keypad to raise your hand. I'll give it a moment. If anyone else would like to raise their hand. Okay, we have a few others. We'll go with the person listed as Des, and then followed by HK Mobile. Go ahead, Des, please state your full name for the record. You have 3 minutes.
Hi, thank you for having me. Can you hear me?
Yes, go ahead.
Okay. I appreciate all the work that you guys are doing. I have been attending these meetings and watching the recordings, and I'm noticing this time a little bit of a switch or a shift in the information and the focus on data collection, which makes me very happy for the community, the houseless community. But when I think about the one big elephant in the room in my personal life and a lot of the personal lives of the Bellingham community as a whole, it's just kind of that healing that I think I heard Jason McGill mention last time. I know myself, I'm still kind of unraveling and kind of figuring out what happened last month, only a few weeks ago, and the way that the city and the law enforcement departments treated our houseless community. Everyone that watched is still watching and is still living in that day. And so, I am not a houseless community. I support our houseless community. I am an activist. And all I can say is that there are a lot of people in this community that are still having to unpack the trauma from that day. And I don't hear it coming, I don't hear it being focused on from this community. I don't think I've, aside from the mayor's statements about it in his interview and on the radio, which those actually kind of felt a little bit more like salt to the wound rather than any type of healing. So just, as a, it's the houseless community is definitely feeling all the pain from that. But there are also community members that are supporting the houseless community that are also feeling that salt to the wound actions that were taken on January 28th. So I would just like, some sort of formal type of healing or anyone to even mention it in a meeting. Maybe in 2 weeks, you guys can come up with something to say about it. But yeah, I just want you to know that there's a huge part of Bellingham that is still hurting from January 28th. Thank you.
Could you please state your name for the record?
Yeah, sorry, I'm Desiree Espericueta.
I'm sorry, could you please repeat your last name?
Yeah, it's a hard one. Espericueta.
Thank you.
Thank you.
Thank you.
The next speaker is HK Mobile. Go ahead and state your full name for the record, and you have 3 minutes.
Hi, this is Heather Katahdin. Hello, Homeless Strategy Workgroup members. I wish to thank the decision of Mayor Fleetwood and the staff efforts of the city and the City Parks Department for creating the Emergency Warming Center at the Depot Market. I was able to volunteer multiple times, and I witnessed the appreciation of many unsheltered neighbors who were welcome to rest inside our market center during a very cold, icy, snowy week. And I was witness to many housed neighbors behind the scenes networking to fill the gaps of bringing newly packaged sleeping bags, blankets, hot chocolate spoons, forks, cups, new hats, new gloves, and hand warmers, and even emergency new pants when there was an urgent need. I'm curious to see a cost comparison between the city staff costs to manage the 7 days at the Depot Market Warming Center and the costs to the city county staff who planned and implemented the January 2021 camp cleanup sweep costs. Homelessness is a challenge that affects and concerns all of us, whether we have the privilege to rent or to own or not. Homelessness is a challenge that can be solved. As a community, we have the land, we have the buildings, and as a community, we have the motivation to create solutions to provide a safe location to rest, to heal, whether it's a room, a house, a tiny home, or a winterproof geodesic dome tent. This challenge can be solved. Thank you each for your efforts in creating real living solutions in our community.
Thanks, Heather.
Have a good day.
Thanks, Heather.
If anyone else would like to speak, please raise your hand virtually by clicking the hand icon or dialing *9 by phone. The next speaker is Kaden Armani. Go ahead, please. State your full name for the record, and you have 3 minutes.
Hi, actually, can you hear me?
Yes.
Okay, my name is Benush Armani. I am calling in, one, to thank you for your efforts. And yes, I have also in this meeting noticed a little shift, and that makes me feel more hopeful. I would like to encourage you as officials in the community to also pay attention to, I believe, I think it was, I can't remember. Oh, it was Amy Glasser who mentioned about the storage issue for the homeless people. I mean, can you imagine if they need anything, how difficult it is for them to just pack up and move? And even when the shelter just for the week opened, the warming center, and I'm sure a lot more people would have taken advantage of that place, but I kept thinking, how would they be able to do that? Because if they leave their belongings, they will be destroyed, stolen. If they want to go there with their belongings, it's impossible. So I've been serving as a volunteer with Safe Storage for the past 1.5 years, and we've been working with the city to get these storage lockers for that community. Actually, we just wanted to start with 12, and we did get the lockers. However, we're still waiting for the city to give us the go-ahead to get those installed. And I think that will be a huge step. I mean, there are many different steps, but that will be a huge step in helping these folks just with their belongings alone. And then, of course, everything else that has to do with getting them housed and off the streets. So that is something that I want you to keep in the back of your minds as you move along. And if you can put a bug in, put a bug in the ears of the city people to help get this implemented as soon as possible. And then, of course, we'll see that we can get more of these lockers installed around the town. Thank you for your time.
Thank you. And with that, that wraps up our 20 minutes. Thank you for everyone from the public that testified today. Kind of the last piece of business, Emily mentioned it at the beginning of the meeting that Joel Kennedy has resigned from the work group. So the county council will be looking at that going through that process of finding a replacement in the next few weeks. So we'll let you know how that goes. Is there anything else for the good of the order? Thank you. Oh, Emily?
Barry, can I just say, we didn't talk about families with children today in the context of shelter needs, but I have to mention that we've got, I think, Terry, I don't know, 65 families in motels right now. And we're seeing about 5 new unsheltered families with children coming through the doors at the OC each week. It's an exorbitant cost, the motel stays. And because we don't have the program capacity in rapid rehousing right now, we're running quickly through a whole lot of money with motels. And we're set to run out of money probably in about 3 weeks as a system. We don't want to exit 65 families with children to the streets, and we don't want to start turning away those families who are coming unsheltered each week as a community. So I just want us to be aware and not lose sight of the invisible aspect of homelessness too, which is children and their parents. And I know the health department is collaborating with the city to try and see what we can do, but there's some urgency here that I hope we can pay attention to so that we don't hit a crisis cliff that then can't be avoided. And all of that trauma that accumulates, and it's like a lifetime of trauma. To Dez's point about trauma that has been experienced in our community over the last month, it matters. The trauma is just it has a huge negative impact. So to the extent that we can stave off some of that with our next generation, it will be better for us all in the long run.
Thanks, Emily. Lisa, I saw your hand.
Actually, I just wanted to thank everybody today, and every week that we meet, for all the hard work everybody's doing. It's appreciated what everyone's doing, and I really appreciate the shift in communication today and data collecting and the direction that it feels like we're going in. It's very nice and refreshing, and I just want to thank everybody for all your hard work.
Thanks, Lisa, for that. Marcus.
Yes, briefly, I just want to thank everybody as well, and appreciate all your time. Want to again just remind you all that SOS is now here, and we're desirous of meeting with the executives. And I just want to take advantage of this opportunity to address those people who are on councils that we're here, and we're trying to be part of the solution. And I consider that we're all still in an emergency, and I hope that we all see it the same way going forward. See you in the meetings. Thank you.
All right, with that, thank you, everybody, and have a fantastic weekend. We'll see you in 2 weeks, if not before.
The recording has stopped.